Very warm good afternoon to everyone. I'm Staff Nurse Rani and I'm here to demonstrate the spacer and inhaler technique. Before I could go into the details, I would like to share you what happens in an asthmatic attack. So here I have a picture of our lungs. Our lungs somehow looks like this. So I have breathing tubes over here, or which is also called airway. So imagine our lungs to be like a straw. So in a normal airway, it is quite straight, cylindrical, round, and more broader and wider. So when the air passes through it, the lungs receives adequate air. Whereas in an asthmatic airway, it is more thinner and narrower over here at the end. So when the air passes through it, there is no adequate entry of air into the lungs. So it causes coughing, wheezing, chest tightness, and difficulty in talking. So everybody or everyone who get an asthmatic attack need to be recognized, as it can be life threatening. So children who are suffering from asthmatic attack need to make sure that wherever they go, they need to carry the space chamber and the inhaler with them. So let us now go into the demonstration. So here I have a space chamber. So the space chamber have two parts. This is back of the space chamber and this is the mouthpiece. Whereas the inhaler contains of a protective cap. This is the cover and the medication is inside. So the medication in here is dry powder. So before you could do the puff, make sure you are ready. Rinse your mouth or drink some water. Take deep breath before you could do the puff. Take the space chamber in your hand and the inhaler as well. Shake the inhaler 5 to 6 times. 1, 2, 3, 4, 5 and 6. Then place the opening of the inhaler into the back of the space chamber. Then imagine my thumb and the index finger to be the mouth and the lips, and I seal it tightly. And I pump the inhaler downwards 1 time and I count 5 to 10 times. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Repeat this process until you acquire the number of puffs as ordered by your doctor. So every time, make sure every time you do the puff, you need to shake the inhaler 5 to 6 times and then put it inside the back of the space chamber and put it in your mouth and seal it tightly with the lips so that there is no leak of air, and count for 5 to 10 times. Once you have done the procedure, put back the things in the designated area. And to clean the space chamber need to be cleaned thoroughly every week, once a week. So take some warm water, put 5 to 6 drops of dishwashing solution and soak it for 15 to 20 minutes. Once the soak is completed, take out from the soap solution and wash it in clean water and air dry it. Do not rub it, as if you rub it, they may develop some static power, and when you do the puff, the adequate puff may not be delivered to the lungs. I hope you have clearly understood the technique of spacer and the use of inhaler. If you have any doubts, please ask me and help me do the written demonstration so that I can make sure that you are sure of the technique. Thank you so much.